Hello, everyone, and welcome to this session. My name is Vera Rodriguez, and I am the Program Officer on Access to Health at the European Sex Workers' Rights Alliance. I'm honored to be here today and to be your facilitator. A big thank you all for joining us for this important conversation. I see already 58 people on the call. I'm very moved by your presence. But before we dive in, I want to highlight that this webinar is being recorded and it will be made public. I ask you to remain muted until there is questions, and I welcome you to use the chat and share your thoughts and remarks. Today, on International Sex Workers' Rights Day, we are launching ESWA's new research, UnPrEPared, a community report on access to PrEP by sex workers in Europe. At ESWA, an improved health outcome for sex workers is one of our main objectives and a pillar of our strategic plan. Criminalization, legal oppression, stigma, discrimination, and violence experienced by sex workers in Europe and Central Asia increase the vulnerability of sex workers to HIV. Moreover, legal barriers and stigma drive sex workers underground. This also hinders the collection of reliable data on sexual and reproductive health issues faced by people selling sexual services and makes it difficult to present a clear picture of sex workers' vulnerabilities to HIV in the European region. Available data shows that sex workers are much more affected by HIV than general population. Despite the recommendation from the World Health Organization for the use of PrEP taken daily for people who are at substantial risk of acquiring HIV, we will explore in this session some of the current barriers that sex workers face accessing PrEP at every level. Adding to this context is the current situation where international financial aids are being cut out. This is making this conversation more crucial than ever. We are thrilled to have Fernanda Belizario, who conducted this research for ESWA. Fernanda is a researcher on migrant, queer, and post-colonial studies at the University of Combria. With over a decade of experience as a researcher, advocate, and activist for sex workers' rights. Welcome, Fernanda. Fernanda will also lead the panel discussion with activists from ESWA's membership, representing their communities in their respective countries. Lilit Martirosyan is the founder and president of the Right Side HRD NGO. She's also a trans sex worker and a feminist activist from Armenia, where sex work is highly stigmatized. Kim Reynaldo is a member of the association PASTT, which is the Association for LGBTQI+ migrant and French community on vulnerable situations, where most members are trans, sex workers, and people living with HIV. Sadly, today we are missing Akinos from the Black Sex Workers Collective, but we are having instead our amazing executive officer, Sabrina Sanchez, who is our executive director, and we'll share a few words about the German context. As we said, together we are stronger, and therefore we are grateful to have two allies in this call. Marc Angel is a member of the European Parliament since 2019, holds a red ribbon for leader from UNAIDS for the 10-10-10 social enable target, and he's also the co-founder of Stop AIDS Now at Luxembourg. Last but not least, Dr. Slava Grankov, who is a medical doctor and public health specialist. Since 2023, he works as a medical officer on HIV and STIs at the World Health Organization Regional Office for Europe in Copenhagen, currently responsible in providing WHO support for 53 member states of the WHO European region. The next part of this webinar, as I said, will be led by Fernanda, who will ask strategic questions to our panelists, followed by an important message by Dr. Slava. Then Fernanda will present the research, and after that, there will be space for questions and reflections, which will conclude in last remarks by each speaker. The session will be closed with a call for a need of alliances and a video freshly launched today. So let's get started. And Fernanda, the floor is yours. Thank you all.
Thank you so much, Vera. Good afternoon to everyone. I would like to thank ESWA for the opportunity of leading this research and also being here to present it. And I also want to thank the hard work, dedication, and attention to detail from the ESWA staff, Vera, Cebor, Edith, Sabrina, and for sure, I would like also to thank deeply all the respondents and the key informants from all the countries that work with us to reach to the result of this amazing report. It's especially important that we are launching this report today on International Sex Workers' Rights Day. That remind us, of course, that sex workers' rights are human rights and that access to health, including PrEP, must be guaranteed to all. We often hear that European countries are global leaders in PrEP provision, which might be right, but when we look closely at minority groups, particularly sex workers, that is our experience, this claim kind of falls apart. And this report we are launching today is the result of community participatory research that wanted to understand if, how, and to what extent sex workers were having access to PrEP in Europe. Through this research was carried out through almost 50 in-depth interviews and literature review of the situation of the accessibility of PrEP by sex workers in 10 countries. Armenia, Austria, Germany, France, Italy, Netherlands, Poland, Portugal, Sweden, and Turkey. As we will detail in the report a little bit further today, we decided to follow the methodology of AIDS Action Europe that organized the countries in 3 different groups in terms of PrEP provision. So they create 3 groups where one group of countries are the countries where PrEP is not reimbursed by state. Other group of countries that PrEP is partially reimbursed by the state. This mixed group are usually represented by countries that have national insurance systems, and so the PrEP is reimbursed through these national health insurance systems like Germany, Netherlands, Sweden, and other group that where the states fully reimbursed PrEP, like France, Italy, and Portugal. So we assume these 3 categories to help us to analyze our data. And of course, the affordability is not the only requirement to ensure access to PrEP by sex workers or by anyone, but it's a good way to organize similar experiences sex workers face in their countries. So we decided in this part of this launching event to address specific questions to different stakeholders that will represent at the first part countries from each one of these categories, countries from non-reimbursed countries, partially reimbursed countries, and total or fully reimbursed countries. So I will move forward by asking one question to Lilit Martirosyan from Armenia that will reflect some parts of the key findings that we reached in our report. So, Lilit, good afternoon. In Armenia, sex workers face an incredibly challenging context. Criminalization, there is no economic support for PrEP, and even basic resources like condom depending on international aid. In this reality, PrEP was reported to be like a distant dream rather than an accessible option. And given these barriers, how does your organization navigate these challenges? Can you share some of the experiences you've had in advocating for PrEP and supporting sex workers' health in this context?
Hello, everyone. Thank you so much for organizing this wonderful and very good Zoom call. And yes, thank you, ESWA team also. So I'm Lilit Martirosyan, the founder and president, Right Side Human Rights Defender NGO. I'm trans woman and sex worker activist. So in Armenia, where sex worker is widely stigmatized, it is extremely difficult for sex workers to access resources like PrEP due to lack of governmental support, legal protection, and often social acceptance. In such environment, the role of activism and community supports become crucial. In the conditions of complete absence of governmental support to sex workers, the community-based organizations work to create awarenesses, build trust with the community, and push for the policy changes at both local and international levels. One of the key strategies we often use is building peer-to-peer education programs where those who understand the issues and the risks can directly share knowledge with others in their community. We as activists in organization create networks that can provide crucial resources like condoms, safer sex education, and refills for PrEP or other health services. Even in the formal healthcare system does not offer these services in a comprehensive manner. Through continued activism, collaboration with international organizations, and community empowerment, sex workers can start to have a more active role in demanding their health rights, even in such challenging environments. The goal is not just access to PrEP, but broader access to health services, education, and legal protection. In this way, PrEP can shift from being a dream to a feasible part of the health and rights agenda for their community. I can share some of the experience that we have lived in our organization around PrEP. For example, Right Side has set up outreaches program where peers distribute condoms to sex workers at high-risk venues, such as street concerts, understanding that sex workers do not trust healthcare professionals or clinics due to fear of judgment. Given the stigmatized nature of sex worker in Armenia, Right Side has faced significant hurdles in building trust with the sex workers. To overcome this, we have used trusted peer or formal sex workers who understand the challenges of the community. This peer education have played a crucial role in the reducing stigma and educating sex workers about the benefit of PrEP. Knowing that information from someone with shared experience will be better received. The Armenia, right now more challenging time that facing sex workers community, especially the transgender sex workers who not have the access to have a PrEP for free. It's all from our side. It's the situation about the Armenia that facing sex worker, transgender sex workers community. And also, I want to share that right now, this difficult time that all fundings cuts, all fundings cuts, its effect on sex workers community, first transgender sex workers community, that they don't have the access healthcare services, educational services, and our organization, like a best sex worker and leading sex worker and trans organization, we providing all this for sex workers and transgender community. Thank you so much.
Thank you so much, Lilit. Moving forward, I would like to ask a question to Sabrina about the situation in Germany that represents the group of partially reimbursed countries or countries that reimbursed PrEP through their national health insurance systems. Sabrina, you know that the sex worker situations in Berlin, where sex work is regulated by specific laws. In 2023, about 30,000 people accessed PrEP through the National Health Insurance System. However, for sex workers, especially undocumented migrants, this regulation comes with heavy surveillance. Sex workers must undergo mandatory health checks and counseling, which has even pushed some nationals to work informally as sex workers out of fear the consequences. If you are a cis woman, for example, respondents in the research reported that to access PrEP means that you either have to prove you have a very active sex life or disclose that you are a sex worker. So if you do disclose, they suggest condoms instead of PrEP. And if you reveal that you work informally, you risk deportation or police confrontation. And if you don't disclose your occupation, you face prejudice as they scrutinize your sex life. And for Black and racialized sex workers, these barriers intersect with systemic racism, increasing the risks of surveillance, criminalization, and discrimination within healthcare. So the assumption of hypersexuality, the scrutiny of migrant bodies, and the exclusion from healthcare protections create a layered form of oppression. So, as you lived in Germany for a while and know the sex worker community there, what can you tell us about assessing PrEP in Germany?
Hi, thank you, Fernanda, for the question, and thank you everybody for being here. It's really amazing that everybody's like so interested in this topic and in this webinar. If I may, I can even add the part from the Netherlands, because even though they're classified on the same on the same tier, they work different. So the first thing in Germany, there's like the first question. First of all, you must have a mandatory health insurance in Germany. It's same like in the Netherlands. The problem is that sometimes the health insurance in Germany depends, the cost of the health insurance depends on how much is your income. So as the most as you earn, the most that you pay. In the Netherlands, it's like a car insurance scheme. So you have like the basic that it's covered, the mandatory stuff that basically gives you access to being cured when you have an accident or whatever. That's already covered. But if you need something else, you pay the middle price. That maybe includes you some glasses every 2 years and some extra things, and like the top thing that includes you like more things. In the case of Germany, also as the access to the PrEP is not by the general practitioner, but usually through the checkpoints. So you go to Sidekicks Berlin or Checkpoint Berlin. In the case is the place I know more, Berlin. That's why I'm gonna ask in this place. But I also know that it's that depend on each lander, on its because it's a federal law. So each lander has their own health system, and it's different in Vera. So I'm going to refer to Berlin. So you go to the checkpoint, and yes, you have to disclose that you're a sex worker in order to get an appointment. If you just are a cis woman that you go to sex positive parties and play parties, that there are by no means no common in Berlin, like nobody does that. So then you don't get access if you don't disclose that you're a sex worker. Then of course can happen the other problem. Checkpoint doesn't check you that you are paying, that you're registered as a sex worker and everything, even if you disclose. So for that part, you're pretty safe that no one is going to tell. But anyway, to recover the cost and everything, you have to go through your insurance and pass the invoice so they can give it back to you. And sometimes it's not possible to have a health insurance because Sometimes you cannot have the famous Anmeldung, that is the registration to the municipality, that in these times of gentrification and housing shortage and housing problem for sex workers, for migrant people, for BIPOC communities, is getting very difficult to get the Anmeldung. So then you cannot access the health insurance because you don't have that. And in any case, you have to cover your own cost. In the case of the Netherlands, you go usually to the in the case of Amsterdam. I also going to refer that because it's where I lived. You go to the Amsterdam Center for Sex Workers, the old PNG, that the ones that already knew that before. Now they changed the name. It's Amsterdam Center for Sex Workers, and of course you disclose there that you are a sex worker. You don't have to be. You don't have a card in the Netherlands, but you need to be registered in the Chamber of Commerce, because otherwise you cannot rent in the windows that are the only legal place where you can do sex work. If you do the sex work outside the windows, then you can have a problem with the police that they really check. So you must be registered in the Chamber of Commerce, but in the Amsterdam Centers of Sex Workers, they don't require that. You just say that you are, and they make you the analysis for free, all the tests. But the PrEP, you have to pay it. It's €7.50, I think, for each box for the 30 days, and that's not reimbursable. It's not covered by the insurance. And well, if you're able to pay the €7, it's fine. But at some point, if you have any emergency, well, you don't have you don't have the PrEP, and you have to pay it by card. You cannot pay by cash. So you must have a bank account. So basically, those are these structural. How is it designed, and how these structural barriers are preventing to a lot of sex workers that not to access PrEP, and remains also like in a close context, in a close setting, or you have to disclose your working status. You have to disclose many things that can be harmful for you. This information that can be harmful if it's leaked, if it's not well taken care. And definitely like how that work. It's not ideal. The German system is definitely not ideal at all. And the Dutch is like, let's say, like, not bad, very, very improbable. So yeah, that would be the thing in that model. Thanks.
Thank you, Sabrina. I will move to Kim to talk about France, the country that is represented, the group of full reimbursed countries. France has a unique context when it comes to PrEP access. It was one of the first countries to fully reimburse PrEP under the national health system. And in 2023, over 64,000 people used it regularly with full government support. However, access is concentrated in major cities like Paris and Lyon, making it much harder for those living in smaller towns. And at the same time, France criminalizes clients of sex workers, as you know, creating yet another layer of barriers to access PrEP. For sex workers, especially those outside big cities, this criminalization, combined with stigma and the risk of discrimination in healthcare, discourages them from seeking formal health services. Undocumented migrant sex workers face even greater risks, with lack of information due to language barriers and the fear of deportation. So, in this reality, community-led services, as in all countries, I must say, plays a vital role in HIV education and ensuring access to PrEP. So, can you share how sex worker-led organizing has been addressing these challenges, and what strategies have helped ensure access to PrEP in your context?
Good afternoon to all. My name is Kim Isit, and before I'm going to start, I would like to thank ESWA for giving us the opportunity to share our experience about PrEP. What we call this, I work as a health mediator in Association PASTT and administrative. I'm originally from the Philippines and I live and work in Paris. I'm a big ally of sex worker community. Before I'm going to go through the question, I'm going to give you a little background about the association. As of today, Association PASTT is the Association for Community LGBTQ+A Migrants and French. The majority of the members are in vulnerable situations, including those who are trans, sex workers, and people living with HIV. The contribution of the migrant sex worker-based association like us, PASTT, is very important for the community. We are the frontliners in giving information and helping with healthcare benefits, HIV/AIDS prevention, and others. Association PASTT was created in 1992 as HIV contamination was very aggressive within the sex worker communities. Since its creation through today, we are helping providing services to the community. One and the most important action of the association is HIV prevention through our Reaching Out Prevention program. Monday to Thursday evenings, 5 times a week, we conduct prevention in some areas in Paris and nearby district with a camping bus. We talk about the importance of sexual health, HIV prevention, access to PrEP treatment, condom use, HIV, hepatitis B, hepatitis C, and sexually transmitted infections. Through the Reaching Out program and our in-clinic collaborated services, we distribute PrEP to the community and other preventive efforts. Association PASTT started PrEP consultation in September 2017 until today. We are working with organizations like Armenia and Hospital Fernand Vidal for PrEP consultation. We provide testing services for HIV, hepatitis B, hepatitis C, and sexually transmitted infections 2 times a month in our office. PASTT and our partners are trying to negotiate having a weekly consultation instead of 2 times a month. At least most of the hospital can offer consultations and can distribute medicines. However, for some who has prescriptions to start the treatment without AMO or the health care, they can only access the medicine on the designated hospitals and their pharmacy. It means you cannot take PrEP, the medicine PrEP everywhere. There are certain pharmacies and hospitals. This is for the migrants without health card. And for the migrants with health card, you can have it in any pharmacy near you. With this existing system, we see significant problems like public judgment and discriminations, as hospitals and their pharmacies are not trans sex workers friendly and are not designed only for PrEP. So we see long waiting times and waiting days to access the medicines. This is particularly difficult for the sex workers who travel regularly and live in rural areas. They need to come to the big cities like Paris to have the consultation and the treatment. But of course, they need to wait more time and days for them to have the treatment. Associations like us understand the challenges faced by the community. So we are equipped with specific resources and personnel who understand this community and their needs. Yes, it's true, PrEP treatment is fully covered by the government, but to protect and support users from discrimination, there should be more trans sex worker friendly hospitals, pharmacies, and associations like us. last year, we conducted 18 consultations for 151 people. 148 were tested for HIV, hepatitis B, hepatitis C, and sexually transmitted infections. We have approximately 80 people on PrEP treatment and demand for last year alone. And we have distributed 15,084 condoms. Through this data and our experiences every day, we see that the importance of the association like us, PASTT, and hopefully we can work with more other association or a sexual-based association in Europe. Thank you.
Thank you so much, Kim. I would like to move forward and ask a question to Marc and Gel. Thank you so much for being here with us for this event. So, Marc, given the European commitment of public health and human rights, what are the concrete steps that the European Parliament can take for implementing equitable access to PrEP? How can European Parliament support activists and community-led organizations push for policy changes? And so what can be done to reduce these structural barriers?
Thank you very much for that question. And thank you very much for all the speakers already. I have learned already a lot. And it's a scandal that it's such an unequal access to PrEP all over Europe for whatever group, be it sex workers, LGBTI community, whoever. I think in a European Union, you would think that there is more harmonization, and we have to work on this. What can the European Parliament do? I am very active as a member of the European Parliament in 3 different intergroups. Intergroups are groupings of parliamentarians from different political families. And I'm co-chair of the LGBTI intergroup, but I'm also active in the ARDI intergroup, which it's the anti-racism and anti-discrimination intergroup, and in the disability intergroup. And we fight for the equality agenda in Europe. We must pay attention that equality does not have the same fate as in America, DEI, diversity, equality, and inclusion, which is completely erased from public policies. We have to defend this in Europe. This is very important because we know if we want to end HIV/AIDS by 2030, we have to end inequalities. First of all, we have to fight stigma and discrimination. And this is where we can help as the European Parliament. I've wrote a letter and many MEPs signed it to the Commission where we asked that the Commission, the European Commission, which is for those who are not so, it's the European government, the EU government, that they should prioritize HIV/AIDS in the new Commission's public health and equality agenda, and that we must adopt an EU action plan to combat HIV/AIDS because otherwise we will not end the epidemic by 2030. You know, it's possible to do it, but we need efforts. And therefore we have to continue also investing in research and in science, because the solution is the long acting PrEP, which and we really have to invest in that and make sure that also this medication become cheaper. We have to the equality agenda is also very, very important because for the moment in Europe, we only talk about competitivity and defense, but we need also the social dimension of Europe, because I believe very, very strongly that if we strengthen the social dimension of Europe and also the equality dimension of Europe, we protect also our democracy. I think this is where we can come in as the European Parliament. What is also interesting is that we have to not only address the health commissioner or health ministers, but also talk to finance ministers and to labor ministers. We have a labor shortage in Europe, and if you have an unhealthy population, if HIV/AIDS, I think somebody has the microphone on. Sorry.
I just muted her.
Okay. So what I was going to say is that we have to talk to different actors, not only to the medical field, but also to finance ministers and to ministers of labor, because you know, investing in what is PrEP? PrEP is prevention. Investing in prevention, it's much cheaper than than paying treatment later. And I give you an example. I don't know if you've shown that in your study. There is one EU member states where migrants, they have their payment, the ARV treatment is paid, but PrEP is not paid. And it's so much cheaper to pay PrEP than pay the ARV treatment at the end. And these are kind of things we have to inform. If I talk to colleagues here in the parliament, I would say 5% know what PrEP is. We have to get all this information. AIDS is not on the agenda anymore, and this is something which is very problematic too. People think it's not a problem anymore, but it is. And the progress this last 40 years, what upsets me so much, we have the possibility to end it, but we have to grab this possibility and really to step up. Also, we have to continue support civil society organization. Also, this is something. When we see what happens in the US, we must pay attention that this phenomenon will not come to Europe. And I see already some it's coming to when you see it, that financing for NGOs who combat climate change or who are being cut. We must pay attention that human rights activists are not being cut their funds. So there's a lot to do for the European Parliament indirectly now, but really, but all this deepening the equality agenda, fighting for more funds for civil society, etc., of course also profits the transgender persons and also the sex workers and the LGBTIQ community. So this is what I try to do with some colleagues. It's not easy, but we're doing our best. But it's important also that not only that civil society is getting very active in the member states to push their parliaments, to push their governments to work together. It's of utmost, be vocal, be loud, go out. And I know the context in many countries it's easy for me coming from the European Union, but I know outside in some other countries, it's not so easy to do that. But we have to continue to fight and just say that we are so close to ending HIV/AIDS, and we just have to do that step. And it costs, and prevention, and always remind prevention is cheaper than treatment. And you know, when it's about money, some politicians understand.
Thank you so much, Marc. I will leave the stage for Vera.
Thank you all for this meaningful conversation. Thank you so much for these tailored questions. Our next message is very important. It's coming from Dr. Slava. As I introduced before, he's a member of the World Health Organization. I'm trying to make Dr. Slava co-host. Maybe Sabrina, you can help me because I believe that he has a PowerPoint presentation. And it's a message recommendation from the World Health Organization. Dr. Slava, the floor is yours. And Sabrina, if you can.
Thank you. Thank you very much, dear Vera. And I am very glad that I can join you, although online. Probably if we were in person, I could even give you a hug. But anyway, it's very important meeting, and I will share my presentation. I already got this possibility. And I will talk about WHO recommendations for sex workers, and including PrEP and decriminalization. So I hope you can see my slides.
Yes.
Yes, and I will swap now. So you can see now the presentation. Good, then I will go ahead. So I will not talk a lot about the epidemiological aspects because they are well known, I believe, to everyone. Sex workers are disproportionately affected by both HIV and sexually transmitted infections. And you can see that there is a lot of research dedicated to this topic, including among female cisgender sex workers, among male cisgender sex workers, and among transgender sex workers as well. And WHO in 2022 issued a recommended package for sex workers in their consolidated guidelines on HIV, viral hepatitis, and STI prevention, diagnosis, treatment, and care for key populations. And you can see that pre-exposure prophylaxis, or PrEP, is recommended as essential for impact health intervention, and it should be implemented everywhere equally. Apart from this, there are many other health issues of particular concern for sex workers in WHO recommendation, including those related to sexual and reproductive health, including safe abortion, contraception, conception, antenatal care, cervical and anal cancer prevention, and of course, screening and treatment for mental health issues and alcohol and substance use disorders. And I'm very glad that we currently live in the era of PrEP options. So currently WHO recommends oral PrEP, tenofovir-based PrEP in tablets, dapavir in vaginal ring, which can be a very useful option for female sex workers, and long-acting injectable. Currently, we have WHO recommendations on cabotegravir long-acting, but very soon lenacapavir will be available as well. And WHO guidelines on lenacapavir are currently prepared and will be available. Probably I'm announcing it too early, but during this coming summer. But it's very important that we don't have only PrEP options, but we offer a PrEP choice. And these options haven't become a PrEP choice for everyone, unfortunately. And even in rich Western European countries, we do not have access to long-acting injectable PrEP currently. And when we are talking to policymakers and program managers, they're still in doubts that it's cost-effective and it will be usable, etc., etc. And I just want to show this one slide on the results on Purpose 1 study on lenacapavir that showed that it's 100% effective in preventing HIV infection among women. It's incredible results, and I hope that one injections every half a year will become a very important option for HIV prevention. And also referring to previous speakers today who told about actually scrutinizing your sex life before prescribing PrEP. It's unbelievable that it still happens. Currently on this slide, you can see WHO criteria for initiation of PrEP. And WHO states that a special request, it meaning that individuals requesting PrEP should be given a priority to be offered PrEP, since requesting PrEP likely indicates there is a risk of acquiring of HIV. So there is no need to scrutinize a person's sex life and look at the sexual risks, because it can be very uncomfortable for a person. And that's why conversation should be focused on achieving sexual health and HIV prevention goals, and gain-framed, not risk-framed. And possible future exposure should be of greater focus than past exposure. We shouldn't ask how many unprotected sex people had, or how many cases of STIs in the past should be before prescribing. And if we look at the ECDC report published recently in 2024 about number of PrEP people receiving PrEP in the past 12 months, we can see that only few countries actually can provide PrEP to a large number of clients. And 77% of PrEP users are in 4 countries among 53 member states, WHO European region. It's UK, France, Germany, and Spain. And if we are talking about key population that is predominantly accessed by MSM, men who have sex with men, 98% of PrEP users in Europe. And it doesn't mean that even MSM are not covered enough. We need to scale up. But if we are talking about other groups, key populations, including sex workers, they are not covered by PrEP services yet. And why this slow and low uptake? Is it availability? Is it about accessibility, acceptability, including right of mix of products, options, or costs, implementing issues? Or is it because of enabling environment, including stigma, discrimination, and laws? And regarding this, WHO has our own recommendation, which is included in the package for sex workers as well. It's enabling intervention essential for impact. It's removing punitive laws, policies, and practices. And recommended package of intervention for sex workers includes enabling intervention that should be implemented as a priority, including decriminalization of sex work, namely removing all offenses that criminalize sex workers, clients, and third parties. And addressing these barriers would not only ensure sex workers' human rights, but also have an impact on HIV, STI, and viral hepatitis. And we can see from research that decriminalization of sex work could have the largest effect on the cause of HIV epidemic, averting up to 46% of incident infections of the next decade. And policymakers, parliamentarians, and other public health leaders should work together with civil society organizations, key population-led organizations in their efforts to monitor stigma and confront discrimination against key population and change punitive legal and social norms. And only while addressing stigma and discrimination at the main barriers, we can achieve good results. And on this day, I would like to thank you once again for the invitation, and just to tell that me personally and WHO stands together with you or in this way in order to achieve these good results. Thank you very much for your attention.
Thank you, Dr. Slava, for this meaningful intervention. The sex worker movement keeps saying decriminalization is the way to move forward, but you know, when it comes from the World Health Organization, seems like that people tend to hear the most. So I really thank you for joining us in this allyship. And now I'd like us to take a deep breath because in the next part of the session, Fernanda is going to take us to present the actual research. Keep an eye on the chat because I will be posting the link where the research is actually posted. And once again, Fernanda, dear, the floor is yours. Thank you so much for holding that.
Thank you, Vera. Thank you for all meaningful speeches. I would like to share a small presentation just for you to follow some things. Let me see if I can get it.
Maybe Sabrina, who is the main host. Yeah, fantastic. Thank you.
Can you see?
Yes.
Okay, I will try. I will maximize it. Can you see that? It's a pity that I cannot see you right now, but that's fine. Can you see the presentation?
Presentation, yes.
Yes, it's showing.
Okay, so moving forward, I would like to present some main issues of the report. Understand it more like an amuse-bouche than a description of the report, because we are so eager to dig into the report and look into it and share your thoughts with us, please. It will be very important. So I would like to talk a little bit how we designed the research for this report. That you know that statistics and public policies are built on data. And they are usually produced by governments and formal agencies. And we also know that these systems often fail to reach sex workers for many reasons. And that ends up that sex workers' needs are not properly represented in these public policies, in this data collection. Even when we are talking about HIV prevention and sex workers are a key population and so on. So that we have a statement from European Center for Disease and Control, the ECDC, that produces the reports that we look into it to know about the PrEP situation in Europe and so on, that say these agencies say that there is a lack of reliable data from vulnerable and minority groups in terms of access to HIV services. And this could be solved, as we also agree, through bottom-up researches that overcome this national data biases. And this report is exactly this. It's a bottom-up research that departs from the community to understand structural barriers that sex workers face in accessing PrEP in Europe. And this report fills this missing data gap, ensuring that the voices of sex workers are centered, but not only understanding sex workers as patients for PrEP, but understanding that European countries remain unprepared to provide PrEP to sex workers, and sex workers knows it because this is a strong community that are actually guardians of public health, that even in most difficult environments, as we already saw in this meeting with the testimonies of our speakers, that even in the most difficult environments, sex workers are there empowering their peers, educating each other and their clients, accompanying a friend for their first PrEP consultation. It was one of the very interesting things that we noticed in this report, that almost everyone that we interviewed that are on PrEP was accompanied by a peer sex worker in their first consultation. So sex workers are in this best position to talk about their realities, and this report, it's really a reflection of this. So this research is based on a community exploratory methodology, and we wanted to understand if, how, and to what extent sex workers are having access to PrEP in Europe, or which are the conditions that influence the access to PrEP by sex workers in Europe. If we look at the literature, the academic literature on access to PrEP, if we look at general works that are not really focused on sex workers, we usually see that they do not consider sex workers in their studies, kind of overseeing the community. Or when we look at specific works about sex workers, they are often depart from a perspective of behavior, trying to understand which is the behavior that enables or constrains access of sex workers to PrEP. But we depart from a different point of view. We depart from the idea that sex workers are guardians of public health, and we depart from the idea that there are structural variables that interfere in the ability of sex workers to have access to PrEP. And so we need to mix the individual conditions, for example, health literacy, and the structural barriers or enablers that led sex workers to search for PrEP to a PrEP program. So we examine in this research not only if a person is enrolled in a PrEP program or not, but the access conditions, the social factors affecting sex work, if there is criminalization of HIV or LGBTQI issues in this country, the status of BIPOC and undocumented migrant sex workers in this country, others, sex worker subpopulations, for example, cis women, cis men, trans sex workers. We have created a matrix of different conditions or variables that may enable or pose challenges to access to PrEP, and we are always looking at this assumption of the ECDC that an effective PrEP program is one in which people are adequately identified, are offered PrEP, and then received continuous support to use it as needed. We were two researchers collecting data. We have interviewed 51 people, but we used only 46 interviews. There were respondents among different subgroups of sex workers. We also include stakeholders, and that we divided into key informants and service providers. Most of them were part of sex worker community too, and we cover these all 10 countries: Armenia, Austria, Germany, France, Italy, Netherlands, Poland, Portugal, Sweden, and Turkey. I could talk about specificities of each model, the three that we have presented before, but I think it's important to start with the general findings, the findings that are transversal to all countries. So it was so important to hear again that one of the World Health Organization recommendations is that the patient request is an important, must be considered one of the important criteria to have access to PrEP, and no country, in the point of view of our respondent, no country respected the wish of the patient to assess the eligibility for PrEP for this person. It's a wide acknowledgement of the community that PrEP is more than prevention, is a source of confidence, is a way of protect yourself without negotiating this protection, as it happens with condom and the clients. Cis women, sex workers face additional barriers to access to PrEP, and usually they have to disclose their activity, and contrarily, in trans and cis gay community, only one respondent reported to have disclosed its activity, her activity to have access to PrEP. Undocumented migrants face additional barriers and bias. PrEP services usually are not integrated with gender-affirming care for trans sex workers, which leads to misinformation and health illiteracy. Integration with other social responses also. Other very important thing, in countries where PrEP is expensive or is not so available, it is reported that that people from sex work community, and not only, share their prescriptions with their peers. So a person that lives with HIV and have access to medication share its medication with their peers to ensure that they have another layer of protection, or one in a group of 5 say that share the costs of PrEP treatment, and say the doctor that this person is in a daily based PrEP, but actually this person takes an event PrEP event-based PrEP to share the medication with their peers. What is common in the full reimbursed countries that is far for the safe haven that people may think. There are long waiting lists. Services are concentrated in larger urban areas. There are problems of distribution, and even there are studies of seroconversion of people that are in the waiting list to access PrEP. Another important thing is that having access to PrEP is also an opportunity to increase the overall education on health and specific on HIV, because people that knows about PrEP, people where PrEP is more spread, the community is more educated about HIV. They know about specificities of lab tests, follow-ups. They are more informed in general. They play a crucial role in engaging peers to start and adhere to the treatment. As I said, all of the respondents went to the first appointment, PrEP appointment, together with another sex worker peer. And also sex workers educate clients about HIV, STI, and bridge a gap of misinformation for the general population, as the respondents reported, due to poor sex education programs for the general population. So they need to explain what is HIV, what is STI, that condom is not only to protect from pregnancy, and so on. There were so interesting statements on that. So following for specificities from each model, so the first model is non-reimbursed countries. Austria was there until last year, but our data was collected on 2023. That is why Austria is here. And we decided not to get off from the report because we were looking at the data from 2023. So in these countries, and you are seeing in the PowerPoint some statements of the respondents. In these countries, several factors significantly hinder sex workers from obtaining PrEP, primarily, of course, the cost. And additionally, the distribution is uneven. There is a lack of information among healthcare professionals that don't know what PrEP is. These elements contribute to the stigmatization of sex workers and individuals living with HIV. And another complication that was well reported was a fear of obtaining prescriptions due to privacy concerns. For example, going to a pharmacy and the pharmacist understand that you live with HIV and talks to another person or disclose your serostatus or your alleged serostatus to anyone. So there are several unstable variables in confidence that also prevent people of wanting to have PrEP. So PrEP in these countries are considered a luxury, are considered something that is it's for wealthy people. So moving forward to the partial reimbursed model, we have Germany, Netherlands, and Sweden represented in this research, as they have effective sexual and reproductive healthcare referral systems and wider cultural acceptance on PrEP. We can say that among cisgender gay men, transgender individual, and gender diverse people, PrEP is well spread. It's part of the culture of these groups. And there is a perception of good and better access. But if people of color, undocumented migrants, refugees still face significant marginalization, and also cis female sex workers, even if they are nationals. here there are some statements here. I will move forward because here there is a statement from a refugee, a trans sex worker. There is a refugee living in the Netherlands. And also in these countries, cis women say that it's impossible for you to go to the doctor and say, I want to have PrEP without facing harassment or doubt about your sex life and so on, as said Sabrina in her statement. Moving forward, I'm sorry, I'm going a bit too fast because there is a lot of letter. I'm not seeing you. If you want to talk to me, send a message in the chat. So finally, in the full reimbursed model that are represented by Portugal, France, and Italy. Of course, in that moment, Italy was implementing that full reimbursed model when we are collecting data. Sex workers in this context still face barriers. Italy was implementing their model, so that it was the country with more severe problems of distribution. Portugal struggles with logistics related to achieving universal coverage, but there were an important program of decentralizing consultations for PrEP for community-based organizations, which is an overall recommendation of this report. If we have PrEP accessibility inside community-based organizations, it may be a good point to improve access for sex workers. In France, respondents reported a lack of welcoming environment for sex workers community, inclusively due to the client criminalization model, disparities in geographic distribution, and also a lack of interest or a lack of effort in including BIPOC and migrant sex workers, as they do not have access to materials translated into their languages. They face bias and prejudice. And also for cis women sex workers, they have a minimal uptake reported despite national guidelines. Healthcare professionals in these countries advocate condom use as a sole barrier for transmission instead of recognize it as a part of combined HIV prevention. And stigmatization by healthcare professional is also prevalent and reported in all of these countries, as in the other countries also. So just to finish this intervention, as I said, it was not an explanation of the report. It was a kind of a amuse-bouche. I wish that it was important for you to have a look in the report. So as a final statement, this report proves one thing clearly, that is, a fully reimbursed model is not enough if it does not address geographic, legal, and social barriers. PrEP must be decentralized, accessible, and adapted to the needs of all sex workers, not just those who fit into narrow policy frameworks. And we saw in this report that it's really narrow. So these reports call for a commitment to community-led solutions centering sex workers in decision-making, decentralized healthcare services, making PrEP accessible beyond big cities, legal and policy reforms, including the criminalization of sex work and anti-racist healthcare strategies, an intersectional approach to public health that acknowledges how gender, race, class, and migration status shape access to healthcare. So, ending HIV, it's not just a scientific challenge, it's a political struggle. Sex workers' rights are human rights. Thank you so much for hearing me.
Thank you so much, Fernanda. For everyone, I've just shared a couple of times the research on the chat where people will be able to see in detail all that you have presented. I really appreciate that you have really highlighted the quotes because making the personal political sometimes really makes clear all the impacts and the barriers that sex workers are facing these days. I don't want to make it very long because we have 15 minutes left, and I'd like to open the floor for questions. I already have a question which I'm going to post in the chat. This question is coming from Ron Reynolds, who is part of BIF Healthcare and is also our current funder. The question is for Marc. I've been keen to know more about the push by MEPs for an HIV action plan mentioned by Marc. Thanks a lot for the great meeting. Thank you, Ron, for being here as well. And you can either think about your questions or post them in the chat. We will give 10 minutes, 15 minutes if people are willing to be a bit longer in this space. Marc, the floor is yours.
So in the letter we sent to the Commission, we asked for this action plan, and this action plan should emphasize on 3 issues. First of all, strengthen combination HIV prevention programs and access to best practices and to best prevention and treatment options. So we have to enhance HIV screening and testing, ensure availability of biomedical preventive measures like PrEP. So PrEP is a very important part of this. The second dimension of this action plan should be to eliminate HIV stigma and discrimination, which we heard today is even more important for vulnerable groups. And we have to do that through comprehensive educational campaigns, of course, professional training, and enforcement of anti-discrimination policies. And here I have bad news. When the Commission proposed the work program for 2025, they erased the horizontal anti-discrimination directive, which is blocked since 2008 because some member states didn't want to vote it. And this is not a good sign. We have to make sure that we are fighting here to unblock this directive or this EU legislation again, so that we have also horizontal anti-discrimination policies. What else? And we have to create also a supportive environment for individuals living with HIV. And the third one is to reach out and engage with the key vulnerable population. So nothing about sex workers without sex workers, nothing about the LGBTI community without the LGBTI community, nothing about trans persons without trans persons, etc. So this is very important. And what I, as a politician, also think is very important, that we come together, the policymakers, civil society, and academia, researchers. When these 3 groups work together, we can come up with good solutions.
Thank you so much, Marc. I'd like to open the floor now to see if any of the 60 people is still in this call, which is pretty significant. It means that the message that we are bringing together is crucial. If anybody has a question, you can speak now. Maybe use the chat. Yes, Amelia from GAT Portugal, thank you for the question. Is there any data about PrEP in prisons? I guess the question is going to be to Fernanda, who's been the researcher. I truly don't know the answer. So if any of the other speakers want to jump in, of course, feel welcome. But Fernanda, to you.
There are data about PrEP in very how can I say, in very different contexts and settings and populations. But we concentrated on sex workers. So I must say that there are not data about access to PrEP for sex workers in prisons, or double representation, sex workers that are imprisoned and if they have access or not to PrEP. But there are a few studies. I don't know exactly, because when we planned this research, we were so specific in finding information about sex workers, because it seems we had this expectation that we will find a lot of things, but we didn't. It was very difficult to find studies about sex workers in Europe. So that's it. But there are data on PrEP in prison.
Thank you, Fernanda. I hope this answer helps to Amelia. I also have a question. I guess it's more of a follow-up from Sabrina, following up the intervention from Marc, saying it would be interesting to know which member state didn't ratify the anti-discrimination directive, in case nationals of those countries are in the room. Thank you.
Yes, it's not about ratification. This directive came out 2008, and it passed the parliament, and then some countries blocked it in the council, which is the member states. And it was not even for ideological reasons that it was blocked. It was blocked because of the costs, which it costs to make accessibility for people with living with a disability. That was a big issue. But now I also am afraid that the whole equality issue, the diversity issue, all this influence coming from the far right, from the anti-gender movement, all this is also a bit playing into the game. So we really have to really make sure that we continue to fight for equality. We will see the 8th of March is the Commission will come up with the new roadmap of gender equality. We have to see if the terms sexual and reproductive health and rights are in it. These are words which tend to disappear from language here in the European Union, and we have to really make sure that these important terms and concepts are not being erased. There is still a progressive majority in the parliament, but I tell you, this parliament, which came out after the 2019 European election, is a bit of a different parliament. Unfortunately, you have the far right, which has been very much stronger. You have the center right, who can find a majority either with the progressives or with the far right. So we have to pay attention that this whole that there has not been an urbanization of the European Union. You have to really, if you understand me, that not that Orban is the one who is right at the end, and not the Democrats. We're not there yet, but we have to really pay attention of this.
Thank you, Marc. I see another question for you and a couple for Fernanda. I'll leave the floor to you first, Marc, since you have the mic open. I would like to ask Marc about the full decriminalization. In 2023, the MEP voted on the resolution of prostitution that was led by his colleague from S&D Group, Mrs. Yeah. This resolution,
Maria Neuschel, yes.
This resolution recommends so-called Nordic model, which criminalizes the client, which is also denounced by UNAIDS and WHO as ineffective. This is further streamed in the various EP resolution. Marc, would you support sex workers by calling for full decriminalization of sex work?
I call on full yeah, of course, we had a big debate on this. I think before talking about sex work, we also have to talk about sexuality and have a whole broader debate, which is very important for our society. So I'm also a bit worried. I dealt a lot with sex workers. We did vaccinations in Luxembourg on the street against hepatitis, and I saw the vulnerability, and I see how many people are exploited a lot of trans people because they're not accepted, they're pushed in it. But there's also sex workers who do it voluntarily. I do accept that. So I come to the conclusion that we have to start a new conversation on this. And if I listened very well to the representative of the WHO, and I think if you combine all these factors, I have to say that this is the right way to follow. But it is a difficult discussion here in the parliament, because you want to also, I was in Luxembourg when I was a member of national parliament. We had a law where we decriminalized it, but it's just the clients are just being criminalized if it's a person without papers. But that was also not perfect. So I think for the best is to completely decriminalize and then see how with other means, not with legal means, but with other means, we can help sex workers to protect their health. We can help sex workers to have a life with dignity. And I think this is, and not combat the sex workers. But also have a discussion on sexuality. I think we also need that, because there's a lot of cliches still going around sex work.
Thank you so much. I'm very conscious of everybody's time. I see questions about Finland, about including the research or not. Fortunately, the research, I think I can answer that for you, Fernanda. That couldn't cover every single country in Europe and Central Asia. But there is another question, if it included undocumented migrant sex workers. I believe it did, and that you read something, but perhaps you want to take this space to answer quickly and then open the floor to the 1 minute final remarks for each of the participants. I'm sorry that there are so many questions still unanswered. Time is ticking. I need to be respectful for everybody's times and tight agendas. So please, Fernanda, if you can answer briefly these two questions and then pass the ball to one of the speakers and so on until we'll get back to me and I'll close the event. Thank you.
Okay, thank you, Vera. Yes, we include undocumented migrants, as Sabrina already answered in the chat. Of course, there are we have a part of the report where we problematize what are the that are main issues. For example, we must have more undocumented migrants represented in the research. These women, people that we consider more vulnerable in terms of accessing PrEP, of the access of PrEP in Europe in this report. But we had, as in every research, time constraints, budget constraints, and everything else, but they are there. It's important to say that it's a community exploratory research. So we start paving the way for future researchers, for elaborate better problems and blind spots that we need to address in terms of sex workers' access to PrEP. We have all sorts of questions about the how can we do together jointly to overcome these situations. I think this report, we need to act. We need to act in all sorts of ways. We need to have reports. We need to have researchers. We need to have advocacy. We need to have an empowered community, and we need to work together. We are not in the place of the winners. We are in the place of the fighters, and we need to acknowledge this position, I think. Just to finish my contribution, you had my email, you have my contact. If you want, please reach me and we can talk longer about the research. But to finish, we have this promise of ending HIV epidemics by 2030, and this promise is grounded on leave no one behind, and we need to understand that right now we are leaving sex workers behind, and we cannot do it, and sex workers will not let we will not let it happen with them, because this is a very strong community and we need to acknowledge that. That's it. Thank you so much for attending this meeting.
Thank you. I will pass it now to some of our community members. Perhaps Lilit, you were the first speaker. You want to share your final remark? Please, no longer than 1 minute.
Thank you so much, Vera. I want to say thank you so much for everyone. Thank you, ESWA, again, for organizing this. My ask every allies, every founders, every networks to support the transgender community and push our government to have access PrEP for transgender and sex workers community in Armenia. Because again, I want to raise this issue that many US fundings cut our organization funding and they don't want to continue to support the transgender community. And right now we need your support to have the access healthcare, educational, to continue our activism in our country. Thank you so much.
Thank you. That will take me to Kim, who was our next speaker.
Again, thank you so much for the privilege to share our work with you. I have a very precise and short message. Sex working is a human right. Access to PrEP is a human right. Sex workers are humans and need to be treated as such. Thank you so much.
Thank you, Kim. I will pass it now to Marc, and then I will pass it to Dr. Slava, and we will close with a remark from our Executive Director, Sabrina. Please, no more than 1 minute. Thank you. Thank you for holding there.
Okay, well, what we have learned is that reimbursement is not enough. There's many other barriers, and we have to overcome all these barriers. So we have to open a conversation about PrEP, inform more of what PrEP is, and how, as I said again, how much cheaper prevention is than later caring and curing HIV. So I think this is a very important message. Of course, the discrimination, anti-discrimination and anti-stigmatization agenda, PrEP is a human right. That's true. Sex work is a human right too. I can now agree with all that. So it has been all said. It's just we need to be louder and talk more about it and raise more attention that we can end AIDS by 2030, but we need to step up our efforts and support civil society too. We know the US cuts them, Europe has to step in and other actors have to step in.
So now it's my turn. Briefly, thank you very much once again for the invitation and all presenters, and Fernanda for presenting the research. I would like to mention that WHO is a normative agency primarily. So our main function is to provide norms, standards, recommendations, guidelines based on the current evidence. And we do recommend simplified and demedicalized PrEP delivery model. But it's a global WHO recommendations, and many countries in the European Union are based their policies on EACS recommendations. And if we look at the recent EACS guidelines, it's still written that PrEP is a medical intervention. And we need to work in future with EACS as well in order to simplify their guidelines as well. And in their guidelines, they recommend PrEP to HIV-negative men who have sex with men and transgender individuals, while it may be considered to HIV heterosexual women and men. So we see that even at policy level, we still have to work with a European expert to change EACS guidelines, and we'll continue doing this. And my last words for today will be that please rely on our support whenever you need it, and please invite us, and only jointly uniting our voices, we can achieve good results. Thank you once again.
Thank you, Dr. Slava. Sabrina, please.
Well, first of all, thank you, Vera, for putting this webinar together. You were in the top of it, getting the panelists and everything. So thank you very much. It was amazing. And the last remark is like, yes, decriminalization of sex work is not enough. Many things have to change, like immigration law, the access to housing, a universal income. So that way, when you have more economic options, sometimes you maybe you don't choose to do sex work. Even though, like, however, there will be some of us that will like actually choose it, and we need to develop this activity with rights and safely. Like thinking that trying to banning and forbidding is going to make us everybody safer, it's a mistake, and that has to change. And this has to change now. Thank you very much, everybody, for being here, and thank you for your attention.
Thank you so much. And as we come to the end of today's event, I want to really heartfelt thank you to every one of you, our speakers, our panelists, and each of you who has joined us today. As you know, the work doesn't end here. Today's conversations, how important it is, how vital it is to keep conversations advocating for safety, for labor, for access to health, for the human rights of sex workers. We invite everyone to continue engaging with ESWA and to use the insights and findings from our research with our work and our advocacy. As we have seen, together we're stronger, and sex workers, we are not the problem. We can be part of the solution.